So as we get everyone out of the waiting room and all that lovely elevator music, let's do a quick sound and video check. You guys see and hear me? I know I have a couple of people tuned in on phones and mobile devices. So on those mobile devices, you have to kind of swipe between screens, and on the phone, obviously, you're not going to be able to see me. But how is the sound quality, sound and video quality? How are we looking out there? How are we looking out there? Good, good. Awesome. I'm excited to have this. This is a first, so you guys are, I mean, we won't say guinea pigs, but in a sense, this is the first time I've done one of these post-exam performance feedback report sessions. And so I'm excited to talk today about your performance feedback report, or if you are going to get a performance feedback report, or if you want a performance feedback report, kind of what you can expect and how you can use that data to help craft a plan going forward for your NPTE endeavors. And so as we get going here, I do have a couple of questions for you. So let me go with, here we'll go with the first question. I am interested to know what audience I'm talking to here. Were you trained inside the United States at a CapTE university? Were you trained outside the United States? And maybe you're working towards coming into the US for to practice physical therapy. Just, these are all totally anonymous, by the way. Totally anonymous. I don't get to see who responds to what. All I see is a percentage. And so it does help me to see what sort of percentages there are out there. And so while you're filling that in, while we go through this, I'm interested to know where you're tuning in from. So in the chat box, if you're tuning in from, just, I can give a little shout out to the city or state, wherever you are. We've got a couple from, let's see, tuning in from Florida, Arizona, Chicago, Colorado. I'm from Idaho. In fact, that's where this broadcast is originating from, is from Idaho. And so I enjoy the cool mountain weather. In fact, we just had snow earlier this week, and so it's now finally starting to feel like spring. Greatest city, Idaho. Iowa, Calgary, Nigeria, Florida. Yeah, those of you in Florida and maybe Southern California haven't seen the snow in quite a while. I know you do see snowflakes occasionally, but anyway. Awesome. So we've got about 50-50 when it comes to inside versus outside USA. Okay, now I've got a couple of questions here for you. This is just all in a row. Number one, have you taken the NPTE? My guess is that most of the people who are here today have taken the NPTE, probably just got their results earlier this week, or looking forward to their results, maybe by next Tuesday. But there are a couple of people who are very interested to know what there is in that feedback report, and maybe how you can learn from the experiences of others to improve your performance. Did you purchase a feedback report? So we've only got about 25% of you who have actually purchased it. The others of you are maybe considering it, or have not decided yet. And so hopefully I'll be able to help with that decision just a little bit. And then, are you considering joining PT Final Exam courses? Again, this is obviously, I'm spending some time talking about these things. I would hope that you'd consider our course offerings at PT Final Exam. I do some live courses that we're starting here in about 2 weeks. I've also got some pre-recorded courses. I've got stuff to fit every budget. So I do hope you'll consider that. Awesome. And then the final question is, how many attempts have you had on the NPTE? How many attempts have you had on the NPTE? I know we've got some people who are first timers who are just getting ready for their, I had someone email me this earlier, their maiden voyage on the NPTE. Others of you are more veteran when it comes to taking the NPTE. I know there are a couple of people who are working towards some of their final attempts, and so I know you're feeling the stress as you go on towards your 6th attempt, and I know we even might have a few people who have appealed for their 7th attempt, which is very, very stressful. So I totally understand the stress that you're experiencing these days. All right, and again, these are totally anonymous. I don't get to see who says what. I just get to see a percentage on my end. So thank you for taking the time. We've got, looks like only about 10 or 15% of the people here are first timers, and then the rest of you are on your multiple attempts. And so hopefully I'll be able to speak to both groups, those of you who are preparing for your first attempt, maybe learning from the experiences of others to improve your first attempt, and then those of you obviously who are on your 2nd or 3rd attempt. We're going to talk a lot about how to craft a good plan going forward. That's the plan here. All right, so just a really, really brief overview. I will be doing another free session here in about 10 days. I'll do another free session where I'll dive into the mechanics of the exam. This audience I'm speaking to today, obviously most of you have already taken the exam, so you know what it is, but just To briefly familiarize anyone who isn't familiar with it, on the NPTE, there are 250 questions. 250 questions. Of those 250, only 200 are actually scored items. 50 of them are pretest items. These pretest items are used to gather data about them in a test environment so that they can be used for future examinations. But you, as the test taker, you have no idea which 50 are the pretest items and which 50 are the actual scored items. It's distributed evenly, so 10 on each of the 5 sections for 50 pretest items. And they're entirely randomized, and there's no way to distinguish them from others. So just forget that they're any different. Answer them as if they were the real deal. Obviously, the PTA test is just a little slightly different in the sense that you only have 200 questions and 150 are scored and 50 are pretest. Okay, so that's the NPTE in a nutshell. When it comes to the scoring on the NPTE, now on the NPTE, they use a scale scoring method. Now, the scale score method, what it is, they use something called the item response theory, and they go into a lot of statistical depth. I've attended the FSBPT's NPTE training on 2 separate occasions in Washington, D.C., and so I've gotten to speak with basically the curators of the exam who work to offer some statistical validity to their choice of using the scale score. Basically, the 600 out of 800 comes to about 75% on the exam, but that varies depending on the difficulty of the exam. Now, the reason they use the scale score method is because on any given exam day, there are a number of versions of the test that are available to students to take. And the reason they do that is obviously so that you and your buddy taking the NPTE right next to each other in the same testing center would be taking 2 entirely different forms of the exam. Same exam, 250 different questions, so you couldn't cheat or communicate about it. I mean, obviously, it's all about reducing the amount of cheating. And so with all those different forms of the exam out there, they have to somehow make them equivalent to each other, and that's what the scale score does. The other thing the scale score does is it makes the test score very sensitive around that 600 mark. Very, very sensitive around the 600 mark, so that some people try to calculate it very, very concretely and say, okay, I was exactly 3 questions away from passing. The truth is we don't know exactly how far you are from passing. However, we do know that once you get close to that 600 mark, they've zoomed in so that just a few questions can make a significant difference there between 590 and 610. But once you get significantly above that, I mean, they start to give out 800s like they're candy. Really, I think you only have to have about a 92% on the exam to get an 800 or a perfect score. So a perfect score does not mean that you scored every question correctly. It just means that they don't care anymore. They're like, yeah, you passed, you passed, you passed, you passed. Meg, you're asking a great question. How much is 500 out of the 800? Let me get out my calculator. I mean, again, it's not an exact calculation. I mean, your rough estimate is that that's somewhere around a 60%, 62%. That's your rough estimation, but it's not an exact, and they actually do keep it quite secret how they calculate the exact score. They try to keep it as they play that one pretty close to the chest, but they do talk about the scale score and why they need the scale score. Okay, so on the test, you do not have to pass every section or every category in order to pass the exam. So it's not like you have mini exams or mini sections that you have to pass in order to conglomerate and make a big giant pass. Rather, it really only depends on your global score. How many points did you score out of the entire grouping of 200 questions? So that means you could totally bomb. I mean, literally, you could answer every question in the non-systems incorrectly and still pass the test as long as you scored everything else, almost all exactly right in the other sections. So, I mean, it stands to reason that you would want to perform as well as you could in every single section, but you don't have to pass every section in order to pass the exam. Now, this is what I'm showing you here is the content outline for the exam. It was updated in January 2018. This is what the FSBPT, the state board, the Federation of State Boards of Physical Therapy, this is what they publish as the content for the exam. Now you'll notice immediately that the big three are on top: cardiovascular or cardiopulmonary, musculoskeletal, and neuromuscular. These three represent almost, what is it? I calculated it. I need, so maybe someone can add those up for me. But it's somewhere in excess of 60-70% of the exam are just on those sections. The rest of the exam is made up by the non-systems. So we've got the non-systems down here, and the other systems, including integumentary, metabolic, gastrointestinal, and lymphatic. A lot of people are really worked up about the lymphatic system. It's not new for 2018. It's just has a bit more emphasis, and they are only asking somewhere between 3 and 8 questions on the lymphatic system. So it's obviously not nearly as heavily tested as your musculoskeletal system at 51 to 60 questions. So with that in mind, obviously you would want to spend a proportionate amount of time studying the big three as compared to spending all of your time studying the genitourinary system, when honestly there's only going to be a few questions on that. Your biggest bang for your buck is going to come from those big three. And maybe the integumentary. I mean, those, if you count those as your largest sections, then that would obviously give you the most bang for your buck. Down in the non-systems, a lot of people stress about the non-systems, and that's something in my course. I have a little mini course on all the non-systems, and I just go step by step what you need to know for the test when it comes to the non-systems. So that's a part of my independent study course as well as the live course. So be sure to check out that. And I had a lot of fun recording those. It's a couple hours worth of material related to prosthetics, research, safety and protection, professional responsibilities, all that. Let's see. Kelsey, 118 to 138 questions on those sections. Thank you so much, Kelsey, for adding those up. I really appreciate that. Okay, so that is the content outline in a nutshell. And again, you can see that a very, I mean, literally, to pass the test, you have to have somewhere in the 135 to 138 questions correct. And so if you just answered those big three, you would be fairly, you'd have to answer all of them correct, but you'd be able to pass the exam with just that. Okay, so the performance feedback report. Now, on the test, once you get the results from the test, you can immediately, at 5 business days after the test, most students are able to see on their login on FSBPT, you can see a pass or a fail, and then generally the score is not available until 10 business days, and it kind of depends on the state. I've seen that some states play that one a little bit slower. They don't let you see the stuff until a full 10 business days. And there are some reasons for that, and then there's some just red tape for that. I mean, the reasons would be, okay, if there was like for instance, I had a student email me that they had the fire alarm go off during the test. So with the fire alarm going off during the test, it made it very hard to concentrate, obviously. And so he's contacting the FSBPT about getting a rescheduled time, hopefully in the short future or in the very near future. But so the point is that they want to make sure they clean up all of those stragglers. Like a couple of years ago, there was a big winter storm in New York that affected several hundred PT students. So they had to reschedule. Anyway, that's the reason for waiting. But I still don't understand why every state is different. Like some states give it to you right 5 days out, and some make you wait to 10. I don't know why. It just depends on your state. So the full performance feedback report, this is a purchased report. It costs $90. And you can get the full breakdown. I'm going to show you some examples and break down some of these performance feedback reports so you can see what is particularly given and what is not given on these performance feedback reports. And you can just, if you Google FSBPT performance feedback report, you can get to the full details and the way to purchase it and all that jazz. So, see Meg, yeah, power failure during my second attempt. Oh, that's no fun. To have the computer blip out on you, oh, that would be bad. Bad news. All right, so let's dive into a couple of these feedback reports. I've got 5 feedback reports, and we're going to talk. You'll see some similarities between them. I've tried to omit any identifying information. So just let's look at these just globally. Hopefully, there will be some aspects that apply to you. Maybe there's some things that won't apply to you. I'm just going to try to break this down, and it's a little bit off the cuff. I sent out the email yesterday about this webinar, and I had a couple dozen performance feedback reports sent to me. So I tried to select some. Obviously, we didn't have time to go over all of them. I tried to select some that were representative, and hopefully what we go over today will apply to you. And if it doesn't, I'm always happy to help out. Always happy to help out. So the first thing you see on your performance feedback report, you see your PT, you see your date of when you took the exam, you see your score. And in this particular person's score, on my screen, it's little. I'm sure it's little for you guys. That's a 586. You can see this person failed 586. You have to exceed the 600 out of 800 mark. This was their first attempt, and so that's what you see immediately on the top. They've altered the format of these just a teeny bit these last couple months, but it's essentially the same. So then you see the first section is listing by professional work activity scores. So the very topmost, this is your total. This is where you list the 586. It's right up there at the top. 586, it tells you how many questions or items you scored correctly. So you can see this person scored 131 items correctly. Now, the passing mark is somewhere in the 137 question mark. But it does vary a little bit depending on which form you're taking. So I wouldn't stress so much about whether you're answering 135 correctly or 131 correctly. If you're in the 580s or 590s, you're very, very close. And so really just answering a few questions correctly will push you over the top. Okay, so then you look down here and you see the different work activity areas. And so on the work activity areas, we've got physical therapy examination, foundations for differential diagnosis, prognosis, evaluation, differential diagnosis, and prognosis, interventions, and then the non-systems domains. And then you have it graphed out here with a box and whisker plot, as you can see down here. So this black line represents the passing mark of that 600 score. So if you look at this individual's attempt, you can see things are fairly even all down the board. That's their total score was representative of all of their different work activity areas. Examination, evaluation, and interventions and non-systems were all very much, you can see it's just very, very consistent across the board. So then if you move down the row here to the body systems section, so they break it down by body systems: cardiovascular, muscular, neuro, integumentary, lymphatic, and other systems. You'll see that integumentary and lymphatic was a little bit lower than the other ones. Now, granted, the average or the mean score on all of these was still a little bit below, cardiopulmonary being the exception. Now, the reason this box and whisker plot is here is because it gives you the retake range. If you were to just sit down and take the exam again cold, or a different form of the exam cold, without any additional studying, this is their statistical prediction of where your scores would be. I think it's like a 90% confidence ratio that you would score within those middle two boxes. So if you look at this person's score report, you would see, okay, overall, they're very close. A 586, you're just a handful of questions away. Obviously, the integumentary and lymphatic systems, which don't have that many questions, you're looking at integumentary 9 to 12 and lymphatics 3 to 8. So a maximum of 20 questions. So really, if they just bumped the integumentary system up a little bit, well, probably more significantly than, I should say, maybe 5 to 10 questions worth on that lymphatic system, and then just did some very small modifications here on the musculoskeletal, neuromuscular, and other systems, obviously that would push them well in excess of the 600 out of 800 mark. So again, looking at this feedback report, it doesn't give you a ton of information. It does give you maybe a little bit of focus. And I guess what I want to point out here is that there's not that many questions in the lymphatic system, integumentary and lymphatic. And so you can see the box and whisker is actually quite a bit wider, meaning that just a few more questions correct in that system would have put you, very much closer to the passing mark. So again, it's not giving you a ton of information, but in this person's case, it gave them a target. They definitely need to hit integumentary and lymphatics, and then bump everything else up just a little bit. All right, so this performance feedback, this is the third page. This is the same one. So we're still on the same person who scored a 586. So now we get to really maybe what I consider the nitty-gritty of this person's performance feedback report. If you look at section 3 and section 5, These are obviously the worst sections or the poorest sections. And I have a couple of guesses why these were the worst sections. If you recall, the break occurs after section 2. And so you come off your break and you begin section 3. A lot of times it's hard to get back into the groove again. I mean, that's, for some people, it's very apparent that they break stride to go out. They kind of psych themselves out a little bit when they're out in the hallway thinking, oh man, oh man, oh man. They go back in and their heart is fluttering again, and it's just, I don't know, they just kind of fall apart in section 3. What's interesting, though, is that did not happen in this person's section 1. They nailed section 1. A lot of times section 1 can be a problem section just because of the jitters. You know, you walk in, you feel the jitters, and it's hard to calm it down. Section 1, section 4, this person just crushed. And then section 5 is where I see, usually between section 1, 3, and 5 is where I see the most problems. And section 5 is usually from rushing or trying to finish the exam with a limited amount of time. Like I had one kid who, he just, one way or the other, he got confused about how many sections were on the exam. So he got to section 5 and he thought he only had like 5 minutes to complete section 5. So he didn't even look at the questions. He just guessed all the way through all of section 5 and just totally bombed that section. And he didn't pass the exam, but it was because of time constraints on, ironically, this kid had kind of psyched himself out and thought there was an extra section, and there wasn't. There were only 5 sections. So on that 5th section, he just blasted through it, and he failed the exam. And really, it was all attributable to that section 5. Good. So there's one feedback report. Let's go to another feedback report. So this is another feedback report. You can see the format is slightly different. Well, Josh, I guess I should look at Josh Cleland. You know, that's a good name. Good name for a physical therapist. Have you ever read Josh Cleland? I mean, maybe you are the Josh Cleland of research fame. But based on your experience, would you strongly recommend students purchase their performance reports? Josh, I'm going to hold that question till the end. I want to make sure we get that question answered. Let's see, Kelsey, seems to be my problem running out of time, yet on all my practice exams, I do not. It's, keep an eye on that clock. I mean, you don't have to stare at the clock. Don't be so, I guess, what do you want to say, so absorbed by the clock that you're not able to concentrate, but you do have to have an awareness for time. Now, those of you who do, I do have some suggestions for those who are frequently and constantly plagued by time. I've got some suggestions for you. Maran, will this be recorded? Yes, we're going to have this recorded, and I'll get this posted to YouTube. So if you're watching the recording later, welcome to YouTube, and I'll have this recording posted just as soon as I can. All right, so in this person's, this is another separate feedback report. So you can see this person scored a 584, very similar score to the last one. If you look here, though, they're not nearly as consistent along the professional work activities. You can see that their examination was very poor compared to their interventions. Now, this was a bit of an anomaly because most people struggle with interventions and not so much with the examination. But this person, they struggle with the examination, not intervention. So it kind of is a roll of the dice sometimes. Non-systems was a little bit plaguey, but again, non-systems, there are only about 25 questions on the non-systems. So just bumping up a few questions puts you over the top when it comes to non-systems. Now we get down here, you can obviously see that in this person's case, integumentary and lymphatic was great, but the other systems, so our metabolic, let's see, go back to my list. So the other systems, the metabolic, gastrointestinal, genitourinary, and system interactions, the other systems in this person's case were very much the worst part. And you could make an argument that this person would have passed if their other systems had been much stronger than it was, because you can see they're right around the border with these guys. I mean, the integumentary and neuromuscular could almost compensate for the decrease on the cardiopulmonary and the musculo, but the other systems, I mean, that just really was the anchor that dragged them down here. And then this is the final page. You can see in this person's by section, section 1 was the best, section 2 was the worst, but not by much. It wasn't extreme in either direction, and then just performed very, very consistently section 3, 4, and 5. All right, so here's our next performance feedback report. Ah, man, my numbering's off. This is number 2, and here we go to number 4. So sorry about the numbering on this end. I was trying to delete some slides and get some things together. So, okay, so this person scored this was their April exam. They scored a 593. Obviously, very, very, very close to passing. I mean, they're just right on the cusp. Now, if you can see here, I mean, this was their 6th attempt, so you can apply for another attempt in your state. To get a 7th attempt, you have to petition your state to go to bat for you and petition the FSBPT for an additional attempt. Now, it's much easier to, like when I talked to my state about what it would take to get a petition and take a 7th attempt, they didn't have a lot of hard guidelines. They just wanted the PT board to feel like the candidate was close or had done something significantly different so that they could then have a better chance of passing. They just want to see an earnest effort to try and take the exam again or have some significant change. If you can't pass it in 6, what's different about number 7? So if you're pushing on exam number 7, make sure that you're working to make yourself a viable candidate for exam number 7. Okay, so in this person's case, the examination part was great, just a little bit off in the other sections. But if we come to the by body systems, you can see cardiopulmonary was just the pits for them. If they had bumped up cardiopulmonary, you can see that obviously would have pushed them over the top. I mean, they just crushed integumentary lymphatics. They were over the top in other systems and musculo, but neuromuscular and especially cardiopulmonary was way down. And then if you go by sections here, again, no real pattern here. Section 4 was the worst, but not, I mean, I don't have any good explanation why section 4 would have been the worst, just the jitters. But again, you can get the jitters in any section, I guess, but it's not the classic case. Really what stands out here is that cardiopulmonary section, that if you could just bump that cardio just a little bit, you'd be over the top. Let's see, Kelsey, have you ever heard of an appeal if you are only 2 points away? Kelsey, if you're talking about the, like to appeal your score and have them grade your exam by hand, I have never heard of them changing a score from failed to passing. In the 6 years I've been doing this, I've had not that many people pay for the manual scoring, but I've never seen them change it ever. And there's a little bit of a philosophical discussion there that if you call FSBPT and ask them, hey, can you check my score? I want to do a score verification. They try to talk you out of it, say that'll be a wasted $100. We score it by computer, and there's no way to. I mean, there's very, very, very small chance that anything would change, much less changing from failed to passing. So, Kelsey, I think that was your question, but I know other people have had that question before about score verification. Now, the irony of that is because so few people do it, that anecdotally, no one gets their score changed. And so I guess the interesting philosophical discussion was if everyone did the score verification, then certainly there would have been a case sometime in the, just statistically, there's likely to have been a case sometime. But from my experience, I've never seen them change from a failed to a passing based on score verification. All right, let's see, just looking through, there are a couple of questions here. We have 4 sections here in Indiana. Let's see, have you heard of appeal to 2 points away? Hi, I'm applying from Canada, preparing for both Canadian and US exams. Cool, Paul. That's a lot of work. The PCE in Canada and the NPTE, they're different, certainly different in terms of questions asked and the amount of questions at the time. So yeah, you're right. Between the Canadian and US exams, the content is very similar, but the structure is different. In fact, I'm good friends with one of the Canadian test prep providers. She's called Physical Therapy Exam Prep, or PT Exam Prep, and does a really good job up there. Are there any pharmacological questions on the NPTE? So yes, Paul, your question was, does pharmacological interventions or pharmacology come up on the NPTE? The answer is absolutely yes. They're fairly basic though, and I think, yeah, you guys are already helping me out there. Jose, are we going to see the correct or incorrect answers from the NPTE on the performance feedback report, or will it just be statistical tables? Jose, You will only see the statistical tables. You will never see a question from the NPTE, which is frustrating because it's hard to learn from your mistakes if you can't see exactly what your mistakes are. But the FSBPT says we might reuse those questions, and so they cost so much to develop that we can't just be handing out all of our exams every single time. So, Jose, you don't get to see your actual questions. You don't get to see your actual performance. You only get to see the report about your performance. Let's see. Jonathan, Will, I know you focused on the NPT, but what could you recommend for the NPTE? So, Jonathan, and I think there are a couple of other PTA candidates here as well. The PTA exam its primary difference is that you don't have the evaluation, differential diagnosis, and prognosis. So much of the advice I'm giving is, what we're talking about here today is very structural. So obviously very applicable. You just have to change it to data collection, diseases that impact effective treatments and interventions for the PTAs. So obviously there'll be some changes about the content, but the structure still remains, fairly equivalent from one to the other. All right, so this person, again, you can see that cardiopulmonary, just kind of back here to performance feedback number 4, is that their cardiopulmonary is what really dragged them down here. And obviously, this is one of the bigger sections on the NPT, so it would take a more significant effort to bring up your cardiopulmonary as compared to one of the smaller sections, which would only take a few more questions correct to pass that. All right, here is Performance Feedback Report 5. Again, don't know why we skipped number 3, but here's number 5 for you. This person, this is just an infuriating 598. A score of 598 is just heart-wrenching, gut-wrenching, heart-stabbing, I don't know what you want to say. 598, 135 questions correct on this form, and they are so close to passing that it's horrid. I wish they wouldn't even give this score, because it's so discouraging. And I know they're just being analytical on that end and saying, yeah, 598 is what you got. But, really it's just so depressing to see that 598. The good news is of the 598 is obviously you're very, very close. And so you can look at this person's performance. Their total, obviously they're just, 1 or 2 questions and they're right there at the mark. But examination, differential diagnosis, evaluation, interventions, non-systems, all these are just hovering so close around the border. But when we come to the body system, you can see that really did pretty well except for 2 significant sections, especially this cardiopulmonary again. Cardiopulmonary and other systems was below 500. Once you get down to the 400 mark, that means that you could guess and get that same score. So other systems really, so at a 598, just a couple more questions in that other systems and the cardiopulmonary would have just shot them right over the top. Then if you go, this is that same person's report, you can see very consistent results, all hovering around that 600 mark in this performance feedback report. All right, let's look at I know there are a couple people with questions. Let's see. Meg, my attempt history shows first attempt. Why is this? Is this a system glitch? That is a great question. So Meg, if the FSBPT system is saying something wrong about the number of attempts you had, it's probably an internal error on their system. I know they do keep very good, and obviously your state keeps a record too of how many attempts you've had. So it's not like you get magically, attempts erased, but it might be just a system glitch. All right, Allison, how would you recommend improving a content area such as evaluation, differential diagnosis, and prognosis? I'm glad you asked that question. Let's see. So let's talk about all of these different areas. So by content area, and so Allison, this is exactly your question. How do you build by content area? If you have a lacking content area, how do you improve those content areas? And content areas, if you recall, examination, evaluation, differential diagnosis, prognosis, and intervention. So I'm a big stickler on foundational principles. And what I mean by that is understanding the why and the anatomy and physiology behind the problem or the issue you're trying to correct. So for instance, let's say you're talking about someone with adhesive capsulitis. Adhesive capsulitis. How do you examine someone who has adhesive capsulitis? What are the capsular patterns for someone with adhesive capsulitis? And why do those patterns show up? Because if you can distinguish the what and the why, it makes it much easier to distinguish between a adhesive capsulitis and a rotator cuff tear. I'll tell you, this was a funny story. I was treating a patient. This was 4 or 5 years ago. I had this lady come in, and she had some shoulder pain. It was her right shoulder, and she came in and she said, "Yeah, I just saw the doctor yesterday. He told me I need to come to physical therapy." And so she handed me the doctor's note with her left hand. She handed me with her left hand the doctor's note, and the doctor's note said, "Frozen shoulder, evaluate and treat." Which, we see frozen shoulders all the time. Frozen shoulder, evaluate and treat, piece of cake. However, when I started asking her about her history, she said, "Yeah, about 5 days ago, I was holding a horse." Any of you who are horse people, no, you'll just cringe when I tell you what she did. She wrapped the reins of the horse around her wrist and was holding on to the reins of the horse, and the horse got spooked by someone or something, and the horse reared back and yanked her arm straight up. It almost dislocated her arm, I think. Yanked her off the ground with that arm and then dropped her to the ground again. And so she went to see the doctor, and the doctor says, "Frozen shoulder, evaluate and treat." And I'm just left scratching my head and like, that doesn't sound at all like frozen shoulder. And sure enough, she had a rotator cuff, a very significant rotator cuff tear. And so I guess the irony here that I'm trying to put to you is that even though this doctor, he knew a lot of things about a lot of things. I mean, he was not a dumb person, but he wasn't familiar with what actually happens with adhesive capsulitis and how that differs from a rotator cuff tear, both in history, manifestation, anatomy, physiology, the whole shooting match. I mean, something that's extremely clear for you and I as we talk about adhesive capsulitis versus rotator cuff tear. That's the sort of stuff you need to be spending your time on in your, especially, well, I find it that it all fits together. That when you're doing your examination, and so we're talking about the examination in the sense of your history, your range of motion testing, strength testing, neurologic testing, special testing, all that stuff. Your exam leads directly into your evaluation. And I, again, a very firm proponent that the history and range of motion testing and strength testing and neurologic testing, all those basic tests, the screening tests, that will tell you 90% of the information you need to know before you even get to the special tests. So the history and your range of motion testing, strength testing, neurologic testing, they all line up to confirm your special testing choices. And so that's why as you become a more seasoned clinician, you find that you're doing fewer and more targeted special tests. You don't do every single special test for the knee when someone walks in with knee injury. Rather, you do history, range of motion, strength, and neurologic testing, and then you make a selection based on your theories. So if it was a pivot twist injury, maybe you'll do the Lockman's test and pivot shift test. If you feel like, if the person tells you they're locking a lot, you're definitely going to add some sort of meniscal test, the Apley compression test, the Thessaly test, or Thessaly, however you say, Thessaly test. Anyway, and all of that then leads to the interventions section, meaning that interventions are based entirely on what's wrong with the person. And so you find a problem and you fix it. So back to our adhesive capsulitis person, this woman, that's a bad case. So just think of someone else who has adhesive capsulitis. You find that they have a capsular pattern. Does anyone remember the capsular pattern of the shoulder for adhesive capsulitis? Go ahead and type that in. The capsular pattern of adhesive capsulitis in the shoulder. Right, external rotation, abduction, internal rotation are all significantly limited. So can you guess that your treatment would be trying to improve external rotation, abduction, and internal rotation? That's not a far stretch, right? You're trying to remedy the problem with your intervention. So the way I think about it is that my intervention is always just incorporated very heavily in what I found in the exam. So you test, treat, and then retest. That's kind of the story of our life as physical therapists. And then I always like to be sure to answer the question why. So why does someone with adhesive capsulitis have limited internal rotation, external rotation, and abduction? Why? Why is it limited? And then you'd say, oh, but Will, it's the capsule. The capsule get these microadhesions. It's kind of like scar tissue formation that causes a shrinkage or a tightening of that joint capsule, therefore resulting in limited range of motion. And so my intervention would then be targeted towards stretching out all that tissue, those adhesions. And so I'd be doing some joint mobilizations. I'd start with grade 1s and grade 2s. I'd work into grade 3 and 4, depending on how the patient can tolerate it. I'd be doing some gentle stretching exercises. I'd have them do a home exercise program of stretching. I might add a few modalities just for fun, but that's not going to solve the problem. Maybe a little heat to loosen things up a bit, but yeah, as long as you can answer the why you're doing it, then it makes it just so clear what the best, safest, most effective intervention would be. Okay, so that's my content area. So Allison, did I answer your question at all? How do you recommend improving content area? I find it's all very foundational. If you can understand the why, then that makes that content area much more solid. And I do find that most people struggle with the interventions. They get a little intimidated by differential diagnosis, but usually eval and differential diagnosis is not that big of a deal. It didn't mean it's a big deal, but examination and interventions are by far the hardest for people, especially interventions. And so the interventions, again, I want to tie that very directly back to your exam data. Okay, so then kind of shifting gears, if it's not necessarily the content area that's bothering you as much as the body system, I, again, highly recommend you study proportionately. That means those big three are going to take most of your time. Cardio, musculo, neuro. Those three big guys are going to be the ones you spend a proportionate amount of time. I don't want you to neglect the others and say, you know, I don't care about other systems, because that could be the deciding factor in your performance. But I wouldn't have you spend 6 weeks on the other systems and 2 weeks on the big three. I would make sure that I'm spending a proportionate amount of time to what is tested. So again, a lot of people have a lot of problems with the non-systems. This is probably the one I get the questions about the most. And like I said, I've got that little mini course about non-systems that you'll like as a part of both the independent course and my live course you can find on PT Final Exam. And that can really clear up a lot of the things and, you know, narrow it down for you. Okay, when it comes to the sections of the exam, 1, 3, and 5 are typically the problem sections just because you have the jitters. Well, and number 5 is because you're out of time. So number 1 and number 3, you have the jitters, and number 5, you're out of time. So to avoid the jitters, now everyone experiences test anxiety to one degree or another. This is a high stakes exam. This is the most important exam of your life because you cannot become a physical therapist, a practicing physical therapist, until you pass this stinking exam. So all that stress and anxiety can manifest itself. You start to lose focus. You read questions improperly. You see best instead of worst, or worst instead of best. Or the worst is when you know the answer to the question, you just accidentally click the wrong answer. Like, why did I click? That's not what I meant to click. But maybe it's the internet gremlins that made you click. I don't know, whatever it is. What I do recommend is doing some mini mental breaks, and 5-10 seconds at a time. Just try to bring the heart rate back down, bring your focus back in by taking two of the deepest breaths you've ever done in your life. And you're all doing it right now. I can tell you're doing it with me. You take a big deep breath in, big breath out. Maybe smile for a second and dive back in. Like, I remember I was playing basketball in high school, and my coach, he would always get after us about things, as most coaches do. I remember I was shooting a foul shot, and I missed my first foul shot, and the coach looked over at me, and I looked over at him, and I was just cringing. I was waiting for it. It's like, come on, Will, you got to put that in. But instead, you know what he did? He said, hey, Will, smile. And it was just like, all the weight came off my shoulders. Like, okay, yeah, I actually like basketball, and so why am I getting all worked up about this stuff? And so took a couple deep breaths, I smiled, and I made my second shot. And, it was just a good example for me of the power of it's not just positive thinking, but just relaxing and trying to remember that you actually like this stuff. And so that's one of my suggestions for those of you who struggle with anxiety. For those of you who have clinical anxiety or a more severe form, actual demonstrable clinical anxiety, those are the people that I highly, highly recommend getting time and a half or extra time on the exam. You have to apply for FSBPT accommodations. And maybe, let's see, if I could get to one of you, Kelsey or someone, if you wouldn't mind just Googling FSBPT test accommodations, it'll give you a PDF link or PDF resource. If you wouldn't mind pasting that link here into the chat box, that would be great. So that if there is anyone who's struggling with, they just never have enough time, they're really struggling with the anxiety, then you can apply for test accommodations, and it gives you a step-by-step process of how to do so. The most common form being time and a half, or having basically 2.5 extra hours on the exam to answer the questions. And for some people, that's all the difference in the world. As soon as they have kind of the weight of that clock off of them, they can just get through it. Now, when I took the exam, I finished with about an hour extra, 45 minutes to an hour extra. I'm one of those people, and I think there's some people here who could commiserate with me. I'm what they would refer to as a seeker, meaning that when I start on question number 1, I'm looking for question 250, and I'm not content until I find that question 250, and so I just plug away. I'm kind of in hyper-focus mode. Versus some people who really struggle with the time, they feel the weight and the stress of the time, and they take all of the time and they need more, in fact. Lavella, thank you so much. So yeah, getting the accommodations can be super helpful. Shakirat, I, on the other hand, felt too relaxed in the exam. I didn't want to panic. So there's, the other end of the spectrum, to be too relaxed. That's probably better than being too anxious, sort of. I guess too relaxed, maybe you're not taking it, with as much focus as you could, but I don't know. Hard to say. Good thing is, though, you just practice, practice, practice. The more you practice, and that's a lot of research, and, I try to be very data-driven in my approach. Much research suggests that practice questions are the most effective way to prepare for an exam. You have practice questions, but obviously you have to know that content. So that's what we do in my class. We focus on practice questions and content, tons of both, to try to get you through the exam. All right, so now let's see, who was it that asked this earlier? Should I buy the performance feedback report? Should you, as a student, drop an extra $90 on the performance feedback report? I'll tell you that if your score, this is kind of my general advice, if your score is close to the passing mark, you will find, like in this person's case, their score was very close, 598. You'll find that there's really not a lot of solid information for you here in the performance feedback report. What I mean by that is that usually, and I mean, just speaking from the human psyche here, if you have a failed attempt, you tell yourself, oh, I need to do better, and just doing better globally would be awesome. And I mean, that's in this person's case, she didn't even have to focus on cardiopulmonary. She could just answer 2 or 3 more in musculoskeletal, and she's over the top. I mean, again, it's not telling you a whole lot. It is giving you some direction, but I can't tell you how many times people have shared a performance feedback report with me that showed they were just close in everything. And they spent an extra $90 to be told they were close. And if your score is close, I'd say in the 580s, 590s, it's probably not what you need. I mean, don't feel any pressure from me, yes or no. But I found that it doesn't usually give you a lot of information. Now, if we go back here to, let's see, which example was it? So like this person's example, their score was in the 580s. So I guess I'm contradicting my own advice here. But you can see a very significant problem in sections 3 and section 5. So again, would you have known that without the performance feedback report? I would dare say this person could already identify that in themselves and say, yeah, I ran out of time, or section 3, I just felt so stressed, I just couldn't bring myself back to focus. And they'd get their performance feedback report and it would simply confirm what they already knew. And so again, 580s, 590s, I wouldn't be too worked up about the feedback report. Now, if we go to, let's see, in this person's case, 593, did I not include anyone in the 560s? I didn't. But usually once you get down in the 570s, 560s, 550s, down below 580 essentially, you'll be able to see there's usually a couple of problem areas that might help you identify. Again, it's not an absolute must. You don't have to get that performance feedback report. And it's an extra $90. I mean, they charge you for it, and so it's definitely, money doesn't grow on trees. But I guess my point is that if you're close to the passing mark, it doesn't give you a lot of information. Especially, Jose, you asked the question about whether or not it gave you the questions you got wrong, and the answer is it does not. It does not give you the questions you got wrong, and can be mildly useful when you're close to the passing mark, and not as useful when you're far away from the passing mark. So just a real quick plug for my class we're starting, and then we're going to take questions. So start thinking of your questions, maybe start typing your questions here. So starting on May 19th, that's our first official date for the live class that we're starting again for the July exam. I run that class on Saturdays and Monday, Tuesday, Wednesday evenings, so evenings and weekends. Those Saturday sessions, it's me talking. I talk about lots of cases. I talk about practice questions. We just have a lot of fun. And then on those evening sessions, they last for about an hour. They go over primarily just core content. We go over like EKG and CAT-SIB testing and just scads and scads of integumentary stuff and wound care and dressings. And I mean, we just go over stuff, lots of stuff, all the stuff that's going to be tested on the exam. It's only $499, which you'll find is about the least expensive. Maybe it's not the least expensive out there, but I have a competitor who charges $2,000 for a class like this. I mean, we're crushing out content at a great price. I hope you'll look at it. We're also the only ones who have real unedited reviews like what you'd see on Amazon. We just passed, this is a landmark, in fact, yesterday was landmark day for me. We just passed 350 five-star reviews from students who've taken the class. Very inspiring stories. If you go and look through those reviews, just click on the reviews tab, and you'll find that there are a couple of copycats out there that try to do that, but they only have like 5 reviews or 10 reviews, or they just have testimonials. You always got to be a little nervous about testimonials because, testimonials are cherry-picked out there. I mean, this is a real review. So very proud of that. We get people through the test. Our average point gain or average score gain is about 50 points. That is average. So I have had people score 150 more. I've had people score about the same. So I don't want to advertise what I am not. I'm not a guarantee pass, but by golly, we go through so much content and practice questions that our average score gain is about 50 points. That being said, and I know there's some people here in the class who did not pass, who have taken my April class. I know you're here, and I want to be there for you. I want to help analyze what went wrong and maybe help with some plans going forward. Reach out to me and we can work something out. I want to be the most awesome resource out there for the exam. And it includes tons of stuff. We've got lots of supplemental videos. You get to reach out to instructors. We do live courses, live classes, and we have fun along the way. That's the other thing, is we like to have fun. We like to, sometimes do silly things, but we keep it light, keep it very solid. And in fact, I was just on the phone with another person earlier today about how the stuff that we talk about, she could identify maybe a dozen questions where what I had said was what they were asking. And it's not, again, I just want to point out that we teach the stuff that will be applicable to the test content. Okay, so questions now. And I see some of you have already typed them in, so I'm going to do my best to get to questions. We'll go for maybe another 10 minutes or so answering questions, and then we'll send you on your way. I know a lot of you are busy and have busy days, and so I appreciate you taking the time to be with us today. Let's see. Let's see. Whom would you recommend it? Meaning 500 out. Oh, see, Meg, if you're talking about the performance feedback report, if you're below 560, I would probably recommend the performance feedback report. Again, it depends. If you already know that you're weak in an area, like a lot of people can already self-identify. They're like, yeah, I don't like musculoskeletal. I was never good at it in my clinicals. I just know I'm bad at musculoskeletal. Chances are the performance feedback report is going to tell you, yeah, you were bad at musculoskeletal. And so if you're not very good at self-identifying, you're like, I don't know where I went wrong, that's where the performance feedback report can be helpful. Dean, thank you. I will say it again, you'll not regret joining the PTFE team family. Appreciate that. I'll pay you later. Let's see. And then Meg, I think your follow-up question, will it help me or just reading the books? Meg, probably, I'm trying to think what to tell you there. Absolutely, you have to dive into the content, so books would be a part of it. But I would say most people can self-select or self-identify where their problem areas are and then dive in there. And you can use your practice questions. I mean, use your practice exams to help identify your weak areas. And so chances are, if you've taken the PEAT exams or the Score Builders Therapy Ed and my exams, if you've taken any of those exams, you'll find that, yes, you performed more poorly on musculoskeletal than others. And so, again, performance feedback report is not crucial, not critical to your success, but it can shed some insight. Let's see, Cedrian, are the live lectures added to the independent course once they're recorded? So, Cedrian, and by the way, thanks for, I know you just signed up for the independent stuff. I post the independent study course are previously recorded sessions from usually 3 months ago. Well, so for instance, right now, our independent study course has the January videos for my PTs. The PTAs I've already updated to the April videos. But what you'll find is that as soon as I complete a class, then I post those videos to the independent study course. So at this very moment, the PT independent study course has the January videos, but I'll be updating those to the April here in just the next few days. And so I update them about every 3 months. So it won't be like every day changing. It'll just be every 3 months. Let's see, Jonathan, the NPTE independent till you pass includes access to recordings of study sessions. Does that mean classes? Yes, that does mean the previous class. So like right now, the PTA independent study course has my videos that I just finished for our April class. You get to peruse them at your leisure. Okay, let's see. Did a course party. Let's see. Living test. Dean, again, appreciate it. Are you going to cover about clinical judgment as well? Yes. So, Jaymuna, I spent a lot of time going over cases where we talk about what would be the most appropriate next step or what you would need to look for, because they love asking you questions on the exam about what would you do next or what would be the safest thing to do or what would be most important. So, yes, we definitely go over a clinical application. And I've had a lot of people tell me that their clinical reasoning improves as a result of the course because we talk about how to apply it in real life. So not only do we help you with the test, we help with how to apply things in real life. Let's see. How much does it cost for the PTA independent study? It's $79 a month, or you can buy Till You Pass access for $200. So essentially a $79 monthly subscription, or the Till You Pass access is essentially 3 months worth, all tied up together, and you have access for up to 2 years. So there's two packages when it comes to the PTAs. The PTs, it's $99 a month, or $299 for Till You Pass access. Let's see, I've just registered for the 3-month live course, but can I still access the independent study course? Yes, you can. Just go to the tab at the top and click on courses, and you'll be able to find the PT independent study course. Plus, if you go to the dashboard page after you log in, you'll find a little tutorial video that'll just guide you through the whole thing. Top of the dashboard page, great place to find that. Let's see, PTFE is really awesome. I like it. Thanks, Violet. Appreciate it. When is a good time to join the course for the NPT prep? So you pass course is a maximum for 6 months. Would it be advisable to join before the credentials are completed? So Paul, with the Till You Pass access, you have up to 2 years of access, essentially getting you through the exam. So honestly, the sooner the better, because then you can start taking advantage of the recordings, the workbook, the study guides, all the stuff, and just really get started and get going. So yeah, sooner than later, especially for Till You Pass access. I mean, even the 3-month access. I mean, the July exam is less than 3 months, less than 90 days away now, and so you want to take advantage of every moment you can. Amy, do you recommend purchasing the PEAT exams? Yes, those PEAT exams, they're not perfect predictors, but they are the strongest predictors out there for success on the NPTE. Not only are the questions and the content, I mean, it's an actual retired NPTE with the same statistics as the NPTE. It's a great study tool because you can go through, not only are you seeing the format, but also seeing the scope, the depth of the questions. Now, I've had people tell me, hey, Will, the PEAT was nothing like the NPTE. And you're right, the questions are entirely different, and there are ranges of questions. So you might have a few more of this and a few less of that or whatever. So you're right, they will be different. But the predictive ability of the PEAT is something that has been substantiated by, many years of statistics pointing that the PEAT is your most solid predictor of success on the NPTE. So Meg, can I get Till You Pass access? How much is it for? I think that's my best fit. So Meg, I've got the independent study course. Till You Pass access is $299. And for the live course, you can take as many live courses. You have access to the instructors, access to myself for essentially up to 2 years for that Till You Pass. That's $895. And so obviously it represents, a bit more time on our end. And so you can see the expense there, but that's our Till You Pass access. Let's see. I've done them. So Amy, talking about the PEATs, I've done them a few times. Do you know if they've changed them? They changed them in October of 2017, and they have a 2018 version. But they probably won't change them again for probably another 2 years, year and a half, 2 years. They don't update them that often, which is, I think is kind of funny. I kind of wish they updated them every year, but the way it is, they only update about every 2 years. Okay, let's see. And Jonathan, thank you. Appreciate that. Josh, when do you suggest I take the PEAT exams? Like how many weeks before the exam? I usually suggest taking the PEAT exams about 3 weeks before exam day. So what that does, it gives you a predictor of where you are, but it still gives you a little bit of buffer time to study and bump up your weaknesses. So taking the PEATs with a little bit of spare time so you can still study from that. Let's see. Elle, if we took the April exam, how soon would you suggest retaking, July versus October? Okay, so great question. It's a little bit of a loaded question because it depends on a couple of things. If you were really close in April and you have a really solid base and you're just, you're in the 580s, 570s, 580s or above, you're close enough that I would say 3 months. 3 months you can do it. 3 months you can easily improve your score 30 to 50 points, push yourself over the top. And because the disadvantage of waiting, there are advantages and disadvantages. The disadvantage of waiting is that you tend to forget things, and human nature being what it is, the more time we have, the more time we waste. And so if you say, oh, I'm not taking the exam till October, usually people let off the gas pedal and they say, oh yeah, I've got so much time, forget about that. And then ironically what happens is they end up really studying 3 months before the exam. And so their 6 month time frame really was just an extra 3 months to forget stuff. So I only suggest planning the 6 month if you can, really be fairly dedicated to the cause of studying for 6 months. And it's tough. Just psychologically to sit there and study for 6 months, that's tough. That's really, really tough. So kind of the short answer to the question is I usually tend to suggest people focus on, the next available exam, so 3 months out. But there would certainly be cases where if you didn't have enough time or you knew there was a big life event happening, that would be a good example of why you'd need 6 months. Jonathan, down in Puerto Rico, got to memorize everything in English now. So that's tough. For those of you who speak another language and are, in your mind you're translating it to English, it's tough too because it just takes longer. It's a little bit more difficult. I speak Italian and a little bit of Spanish, a little bit of precious little Spanish, but in my mind, I'm translating and it's slower. It's not as clear. Anyway, so I totally feel you there. Waiting is bad. My mistake. Let's see. That's what I did. Does the exam get harder individually as we increase our attempts, taking a third time? Anand, the answer is no. This is not a computerized adaptive test or a CAT. This is just a straight 250 block of questions that is equivalent to any other 250 block of questions. So it does not get harder the more attempts you have. It is the same, not the same questions, but it's the same test, same difficulty, same content each time. So Meg, for 500 out of 800, how many months would you recommend and how many hours? So the short answer is a lot. 500 out of 800, that's a pretty solid distance from passing, the 600 mark being the passing mark. So I'd be right on the fence. I'd be thinking, if you could dedicate, 2 to 4 hours a day for the next 6 months, that would probably be better than trying to cram 8 hours a day in for 3 months. I mean, there's no exact formula. I'm kind of grasping a little bit at numbers here, but usually I would say that the 500 is low enough. You might really consider the 6-month plan, so then you have time to really digest it. But the trick is you can't waste time. You can't just take 2 months off and dive back in and pretend like that 6 months was helpful. It can actually be very hurtful. Let's see. Okay. Awesome. Thanks, Dean. Any other questions? Any other burning questions you have for me? I mean, we're at the hour and 4 minute mark. So I want to wrap this up here in just a moment. But again, those of you watching this later on YouTube, be sure to check out the course. You can go to ptfinalexam.com. Those of you here today, check out ptfinalexam.com. I think you'll like it. In fact, I've got a whole section on lymphatics because that's new for 2018, or at least not new, but more emphasis in 2018. I've got a whole section on lymphatics that people tell is just spot on. I mean, I take it right out of the textbook. We kind of dissect all the little nitty-gritty things you need to know for lymphatics and can be really helpful. Will, where can we get that shirt you're wearing? So a little PT Final Exam swag. You'll like the back of it. I should send out pictures. Great question. I should put a little T-shirt, T-shirt shop on the website, so people can wear the PT Final Exam swag. Any of you who were at the APTA, the combined sections meeting, I was there giving out free T-shirts. So if you see anyone wearing the PT Final Exam T-shirt, you know that they saw me, and that was down in New Orleans. That was a lot of fun. Let's see. Okay, well, with that, I think we're going to wrap up. Thank you so much, guys, for spending your time with us. I'll get this posted as soon as possible to my YouTube channel. I'll also have it on the website blog. And so I really appreciate you guys taking the time. Remember, just remind yourself that you're good at this. You're really good at physical therapy, and you just got to pass the stinking test. And I know it's tough, and I know it's going to be, it's never fun what you're doing now, but you can do it. You can totally do it. I've seen so many people. Last year, I had a 65-year-old woman. I mean, get this, 65 years old. She graduated from PT school before I was born. 65 years old. She's trying to reinstate her license after 30 years out of the field. She studied it. She did a 6-month plan because obviously she needed a lot more time. She passed on her first attempt back. 65 years old, out of the field. And again, for me, that just tells me, if you can do this. You can do this. It's not insurmountable. You can do this. And so very, very inspiring story. And if you go check out that reviews tab, you'll find a gajillion. You'll find 352 inspiring stories that help you see how people overcame and what we can do to help you. So if you get a little down, just go read those reviews page, and you'll find a lot of comeback moments for these people that they're practicing therapists now. And that, for me, when I honestly, sometimes if I'm feeling a little down on myself, I'll tell myself that, I was able to help a whole generation of physical therapists get out there and treat people and treat them well, treat them effectively and efficiently. And it's so much fun. Love it. Love it. So with that, I'll sign off, guys. Will Crane fist pumps all around. Send me an email if you have any questions. I'll try to get back to it as soon as I can. I've kind of got the email inbox full these days. But I'll try to get back as soon as I can and give me a little leeway there. But I'll be happy to help as much as I can. Have an awesome day, guys. I'll get this posted, and fist pumps all around. We'll see you guys.